Welcome to a new edition of the Mind-Gut Conversation podcast, a place to learn about the latest ideas from thought leaders in the area of health, food, the science of mind-body interactions, and the environment. Today, I had the great pleasure to speak to Dr. Nancy Zucker, a professor in the Department of Psychiatry and Behavioral Sciences at Duke University School of Medicine, who is a renowned expert in the area of eating disorders. Dr. Zucker is a clinician, researcher, and teacher at Duke, where she founded and directs the Duke Center for Eating Disorders. She is the author of numerous professional publications, as well as an author of the upcoming revised practice guidelines for the treatment of eating disorders from the American Psychiatric Association. Dr. Zucker's major clinical and research interest is in understanding how to help young people develop a healthy awareness of their body's signals, a process referred to as interoception in biology, and learn how to match these two actions that allow them to flourish. Her research and clinical work has been featured on ABC's Nightline, the BBC, the Wall Street Journal, the New York Times, Time magazine, and other major news outlets. I had the pleasure of interacting with Dr. Zucker scientifically over many years, most recently on a scientific publication about the brain changes in patients with anorexia nervosa. Welcome to the show, Dr. Zucker. Yeah, so let me start out with asking you, can you briefly describe how you got into pursue a career in eating disorder and specifically in anorexia nervosa?
Yeah, so kind of an interesting story in the sense that when I was in college, I spent a year living in a sorority house, and in the back of the house was a bathroom that was kind of known as the vomitorium, where women would go self-induced vomiting. And at the time, it so happened that there was a researcher at where I was going to school, Linda Craighead, who was developing really body-focused interventions for bulimia nervosa. And so the combination of running into friends who were struggling in my daily life and having the capacity to help develop an intervention that would help was kind of very compelling, and I was hooked.
And so you've pursued this ever since. That's actually...
Ever since. There's been a few times I've tried to diversify and study other things, but I seem to always get pulled back into it. So
yeah, that's really cool. I mean, I'm not an anorexia or eating disorder expert. If anything, the kind of eating disorder that our group has sort of gotten interested in, besides collaborating with you, has been food addiction, which is sort of the other end of the spectrum. But how big a problem is anorexia nervosa in the U.S. population, and have the prevalence numbers increased, particularly during the era of social media?
Yeah. So the prevalence for anorexia has historically been about 1%, but in recent years, especially with COVID, there has been just a reported, startling increase in programs for eating disorders, reporting an escalation in the number of cases that they're seeing. And the one trend that seems to be happening around the world is that the incidence of anorexia is getting younger. So it's emerging at younger ages. And we don't quite know why, but social media certainly is a likely candidate. If you think about individuals who are genetically vulnerable, biologically vulnerable, and they encounter environmental triggers to instigate the onset of something, social media would certainly be a likely target, with just individuals, some individuals teaching you how to have an eating disorder or engage in excessive exercise or do a lot of healthier extreme weight loss behaviors. So vulnerable kids could see that stuff and copy along.
Yeah, I mean, the things that I've experienced with social media is sort of an observation that it seems like young women that pose in in their bikinis and easily reach like hundreds of thousands of followers with almost like often meaningless postings. And um,
Yeah.
so there must be a tremendous um, encouragement to do that. I mean, just to
Yeah.
look beautiful on an Instagram post.
Yeah. And it's right. It's tragically sad, right? In terms of, like in terms of kind of female empowerment, right? And wanting to get people to know people authentically and see into people's souls and all that. And to think that, are we just objectifying ourselves by doing this kind of thing, and not, really portraying ourselves as the complex individuals that we are by having posts like that and feeling pressured to post things like that and feeling compelled to post things like that.
Yeah. Yeah, so that was actually, this question. Has that been tracked at all in terms of, the relationship of social media with the prevalence and
There have been some things. So what has been looked at is the manner in which people engage with social media. So it might not necessarily be a frequency thing. Like it's not necessarily a dose response. Like the more you do it, the more dangerous it is. It's more how you do it that the research has shown so far. So there's this feature called social comparison, which we all do, where but to very varying degrees, right? So if it's one thing to look at social media and to have your friend, have a lovely time with other friends and say, oh, isn't it lovely that my friend had such a lovely time with other friends? And it's very different to make it self-referential to say like, oh, my friend had such a lovely fun with other friends. I didn't have as much fun as them. Like I'm not as well liked as them. I was invited, and to kind of make everything that you see make yourself feel worse by comparison. And so when you engage with social media in that way, that seems to be a very toxic way to go about engaging with it, and you end up feeling worse about yourself, and then try to do things to follow the formulas then that you're given to improve your popularity, eat differently, exercise differently, etc.
Yeah, we've often talked about this high comorbidity that anorexia nervosa has with other mental disorders, in particularly anxiety disorders. Could you explain this briefly? Why you think there's such a close link with anxiety disorders as a risk factor, I guess, and a comorbidity?
Yeah. It's a kind of $1 million question, right? But it's really interesting, right? When you think about anxiety disorders are some of the most prevalent disorders, and they often usually come before anorexia, so they emerge earlier in life, right? And then only if roughly 18% of individuals at a time will have an anxiety disorder and 1% has anorexia. It's interesting to think about what is it about. It can't be anxiety in general, right? Anxiety in combination with certain metabolic risk factors. Mm-hmm. I'm very interested, as you are, and gut-related risk factors in terms of early GI events that increase preoccupation with the gut, diet manipulations as a way to feel better, and all those in combination with anxiety as being a vulnerability for anorexia. In fact, we have a cohort study that was published several months ago that showed that recurrent abdominal pain actually increased the risk of fasting in girls using the ALSPAC data cohort. So showing that, in fact, right, these GI events could be vulnerability factors for anorexia later on.
Interesting. Yeah. So you sort of addressed this topic about I guess both of us are very interested in brain gut interactions and possibly brain gut microbiome interactions. So I was just going to ask you what role does the gut play in this? So this could be a trigger or to out of this pool of patients with anxiety disorders. So some have GI symptoms and develop IBS. Others, have some GI event that might shift them towards anorexia. Is that a good?
Yeah, that's right. I think that's a really accurate way to put it. Once you have anorexia, the prevalence of GI events is like 95%, just like everyone with anorexia, by virtue of, so we know that starvation exacerbates, GI events, right? But this notion that they could be a triggering force, right? That then gets worse or gets different because of starvation. And then of course, we know kind of attention amplified, can make things worse, or the quality of attention can make things worse, but it's certainly their dietary habits is not improving their GI symptoms. So it just seems kind of a vulnerability exacerbated by anorexia, and then making recovery harder, right? Because they're uncomfortable, right? They're more focused on their gut and all these things. And none of our intervention strategies incorporate that. Don't specifically try to have diets that would make GI events, improve GI events or address this kind of gut hypervigilance. So it's a gap that we need to really address.
So there's no specific diet that's being recommended. I mean, so we've just in the middle of writing this review article on nutritional psychiatry, and we hadn't really included anorexia in it. And then one of the reviewers commented on this, one of the most common psychiatric disorders is anorexia. Why didn't you, include this in this article? And since it's about diet, I wasn't really aware of significant literature that you could discuss there. So is that correct?
That it is correct. It's really, to our field's credit, right? It's challenging in the sense that, so you have people who are, so one of the core features of anorexia is this fear of weight gain. And so what happens is, and with that avoidance of foods, high calorie, high fat food, whatever the kind of the declared poison is of the moment. And so when you're an interventionist, what you're trying to do is have individuals who are afraid of things approach things that they're afraid of. And so they're kind of just trying to, don't be, have this, eat this, that, and the other. And they're so obsessive about certain types of food and not certain types of food. It really has been, let's increase comfort across the broad range of foods, which makes complete sense. But what gets missed is this notion of we could actually, change one's relationship with food if we really thought about their microbiome, about, the things that would kind of suit them best. And then they might, because I think of the core as anorexia as being body distrust. And so if we could introduce diets that kind of catered to what people understood about their gut health, would that make them feel more safe? Would that make them feel more trusting and really more connected with their bodies? So I think it's a really interesting thing to think about for future research.
I mean, it seems to be something that, I don't know, it was Michael Pollan or somebody has called this the national eating disorder that we're going through increasingly. During the pandemic, the number of podcasts that I've done, on this topic, gut health and, gut immune health. And, and there seems to be this total confusion of what's actually, good for somebody or for somebody's gut health. You would think in the meantime, with all these books and internet information that's out there, people wouldn't ask that question so commonly, but it hasn't gotten better. So if anything, and I'm sure this does include people with anorexia nervosa as well, but in general, it's the lay public that is completely worried about what to eat, what's good for me, what's bad for me, how can I keep my weight down? So it seems like anorexia is really just the tip of the iceberg of something much larger. Yeah,
I agree with that. And what's so interesting about it, right, is this notion that being anxious about it, right, which of course, and people with anorexia are, but the lay public is increasingly, right, just kind of amplifies, right, any gut reactivity. And so, so the folklore that people develop about I can eat this and not eat that is hopelessly complicated by their anxious reactions to what they think will work or not work. And so it gets quite confusing.
You mentioned briefly the microbiome as well. I mean, are there any, I should know the answer to this question, but I thought it would be good to ask you as well. Are there any is any good evidence that you think is trustworthy in terms of microbes playing, so not just being involved secondarily when you're fasting, obviously you will change your gut
Yeah.
microbes, but that they might play a primary role, that there's a particular gut microbial species producing a neuroactive metabolite. Some of these have shown up in different disorders, from autism spectrum to seemingly unrelated, cognitive decline, like these indoles. Have you seen any evidence that there's any convincing evidence that microbes may play a primary role, or they're just like part of this brain gut microbiome system that?
Yeah. It's such a great question. So studies on anorexia are always so hard to do at the population level, right? Because the prevalence is low, right? And so the ideal study, right, would be tracking the microbiome of, a cohort of prepubertal adolescents over time, and looking at kind of, microbiome vulnerability factors. And to my knowledge, that has not been found, but speaking here, there certainly is the studies that you mentioned, though, characterizing abnormalities in the microbiome of individuals who have been ill, and even some that have been weight restored.
So we've worked together, our groups have worked together on a comprehensive research study on looking at changes in brain networks in anorexia nervosa patients, and pointing towards pretty plausible changes in some of these networks. I mean, could you just summarize what you think for you the most important findings of the study were, and what consequences has for your work, like for your interventions?
So I think, that when I try to explain the essence of anorexia nervosa to people, so they can kind of really get into the headspace of people who experience it, I really explain it as just a fundamental distrust of one's body. So you just, so your body, like your stomach growls, right? And you don't trust that that's really hunger, or you think that there's something wrong with your metabolism that's misfiring somehow, or, you get some signals, and so there's this. And if you think about, how fundamental, of course, our relationship with our body is in terms of knowing what emotions that we feel, and being able to be responsive and nourish ourselves when hungry, sleep when tired, and that sort of thing. So to me, that's the essence of anorexia. And that's what our network study, to me, showed, right? That the sensory motor network, the signaling, the kind of the health of that network, the communication, consistency of that network was impaired, for lack of a better word, relative to typically developing controls. And so kind of a, a neurobiological kind of correlate of this kind of this unreliable signaling, right, from the sensory motor network. So that was the part that I was most excited about. And so, in answer to your question, the way where my research has gone over the years is I keep going younger and younger to try to find where, if you want to teach kids to trust their bodies, where do you start? And so, I started working with adults. Now I'm at 5-year-olds. Probably by the time I retire, I'll be, working with sperm, who knows what I'll, but at this point, I'm at 5 to 9-year-olds and kids with tummy pain, right? So thinking about who are the vulnerable kids, these anxious kids with these early GI events that we know predicts chronic pain and later depression, anxiety, potentially eating disorders, and really working with them to trust their bodies. So doing what's called interoceptive exposure, where you intentionally bring on different body sensations, and the kids learn to label them. This is Gassy Gus. This is Patricia the poop pain. This is Georgia the gut growler. And so to kind of really treat their bodies as a source of reliable information that they can respond to and know what to do with, and then kind of get to know themselves. Like, oh, when I'm feeling this way, I should, eat something, and then I won't get hangry, and that sort of thing, and seeing whether we can kind of circumvent some of these terrible outcomes, such as anorexia nervosa.
Do you have evidence from your studies that actually changes the trajectory if you expose kids to this kind of interoceptive training or getting to know your body training?
Well, I know at this point that it reduces their abdominal pain symptoms and lowers their anxiety and lowers their fear of their bodies, so that they're not scared of their bodies, and that they know more about, they know more about their emotions and they know more about their bodies. So I feel like it's all the proper ingredients for later protection, but I don't have data showing that it actually reduces the later onset of eating disorders. That's the hope.
And when you enroll kids in your studies, I mean, do you know, are these kids with a history or with a particular risk factor for anorexia, or do you take all kids?
So I take kids who meet criteria for functional abdominal pain. So these are kids, right, that have recurrent stomach aches, over a several month period. And so that's how I'm screening them. And when that's your screener, you very likely get kids who are also anxious because they travel together so much, as you indicated.
Do you think things like, there's a lot of excitement now amongst these internet enhanced modalities like, cognitive behavioral therapy, for example. Do you think that's another approach that could be tried in kids that are at high risk for that? I'm not sure if those modalities already exist for children, but certainly for adults seems to be.
Yeah, so certainly the most effective treatments for functional abdominal pain are cognitive behavioral therapies. One of the things that I was trying to do with this intervention, one, because they're little, and they don't, and the kind of the content of their mind, they don't necessarily have access to quite yet. And they're so, I call these my sensory superpower kids, right? These really, sensitive kids, and seeing that, like, going in with a more body focus rather than a cognitively focused way was just kind of an interesting experiment. And contrary to the pain literature, right, where it really oftentimes it's about distracting from pain and not thinking about pain. So it's a really interesting thing to say, could we actually alter the quality of attention if we make kids curious about their bodies? Will it backfire? Will they become more preoccupied and we've made things worse, or do we actually improve it because we're reducing their fear? And that seems to be what happened by changing the quality of attention. We don't make them more preoccupied, we just make them more knowledgeable.
So in your model, so there's definitely one area, interoception, that, there's been a lot of excitement about this a decade ago with, even identifying the brain circuits that underlie that. Do you think, children that are prone to this have something that's also been referred to as multisensory hypersensitivity, or do you think it's mainly an attentional problem that, they have the same sensitivity but the attention and the processing then kicking in the salient system is off, and that's why they then develop the fear of these sensations?
Yeah, I think it's a great question. I think, my guess would be, if forced to answer, forced to kind of weigh, I would say both, right? That there, for a lot of these kids that I interview, right, there are these early life events, right? These early aversive visceral conditioning events, that just from a Pavlovian, like even the I'm just fascinated by early GERD, quite honestly, like what happens for my kids who are early, food avoidant, what happens to, pain amplification. If you eat and there's pain and you eat, there's pain, it's kind of the perfect classical conditioning experience. And what happens to memories, how are memories of those very early events, encoded and remembered, even if they're not consciously remembered, and does that kind of set this attentional system in play? So that's, I have no data to support any of those links, but it's just interesting to me how much those early events show up in the patients that I interview.
So going back to, to parents that have a child that they notice, like particularly picky child in terms of eating, or are there any warning signs that you would recommend to parents to pay attention to? And if they notice there is an abnormal, development, what should they do? I mean, what can they do early on?
Yeah, I think, well, I think that we're all getting much better at identifying these kids earlier. And that's going to be hugely helpful, right? Because I think that due to, no one's fault, but just our increased emerging understanding about kind of the bounds between what is kind of developmentally appropriate food avoidance, a child kind of, learning to be more afraid and more tentative, and so naturally becoming more neophobic as a healthy adaptation versus kids who are kind of stuck and fixed. I think we're learning more about how to differentiate those kids. I will say, the kids that I work with, it starts young. Parents report, problems even transitioning to solids, chunks in baby food, kids really having a kind of disgust and avoidant reaction to that. But again, there's no good data to say like, that's your warning sign. It's more just prepare, trying to, help parents to, work with their child on really on kind of anxiety management strategies, soothing strategies, keeping the food environment more kind of fun and enjoyable, which is really easy to say and impossible to do when you're anxious as a parent about your child getting enough to eat.
Yeah.
It really becomes this vicious cycle.
Now, fast forwarding into the future. So, for example, a family has an anorectic child. That child goes through successful therapy. Is it likely, or how common is it that there's other, like for example, chronic abdominal pain persists? So the food behavior, the ingestive behavior component is managed. So the life-threatening component is managed, but other things now dominate, like chronically recurring. So, I mean, the reason I ask this question, I personally have a relative, a niece, who has exactly gone through that, and has been suffering from chronic headaches and chronic belly pains ever since she has overcome the anorexia.
That's so interesting. Yeah, it's fascinating. So the short answer is we don't know. It's a fascinating hypothesis, something to explore. What we do know is that one of the most persisting features of anorexia is body image disturbance, and that's different than people think it is. It's not just an evaluation component, like I don't like the way I look. It's it's embodiment, right? How your body feels to you, and and comfort with your body, and again this trust with the body. And so from the standpoint that that's the feature that persists even with weight restoration, that would seem to be a vulnerability for all the hypervigilance and symptoms and discomfort. So it's interesting to think about that.
Okay. Is there anything that you would want to say that is particularly exciting, or is a particular challenge for you in your in your young career that you still want to resolve?
Again, the take home would always be, so for us all to work on trusting our bodies more, and role, and giving little people just good role models of what that looks like. So they, if they do go on social media, that's what they see, as opposed to people who are objectifying or abusing themselves in that way. But I do think starting young makes a lot of sense because we know who these vulnerable kids are.
Yeah, so thanks, Nancy. It was a really interesting conversation. So you updated me, because we haven't talked for a while, on some of my most pertinent questions. And yeah, good luck with your research. I can't wait to see some of the outcomes of these studies that you're doing. And,
thank you so much. Thanks so much for having me.
Okay, talk to you soon.
Thank you. Okay, take care. Bye.